Welcome to American Indian and Alaska Native Living, a program designed to educate and inspire listeners throughout Indian country. American Indian and Alaska Native Living is hosted by Dr. David DeRose, a board-certified specialist in both internal medicine and preventive medicine. Dr. DeRose has a wide range of experience with Native health issues, and he is here today to help you learn more about your health. Here is Dr. DeRose.
Welcome to American Indian and Alaska Native Living. I'm Dr. David DeRose. Today we've got an amazing show lined up for you because I have an amazing guest. I know he's an amazing guest because there's all kinds of people throughout the world clamoring to get him on podcasts and before live audiences. My wife was just at a big medical conference, and there, speaking for that conference, was Dr. John Scharffenberg. He is my guest today. John, it's great to have you with us.
Thank you.
John, a lot of people know your name. You've been doing a lot in public health, preventive medicine over the years. You're both a medical doctor. You also have a master's degree in public health. But one of the things I've noticed that a lot of people have been quite interested in with your busy speaking schedule and all is somehow people want to talk about your age. Does that make you feel uncomfortable?
No, I'm 100 now.
That's remarkable. I mean, you're 100 years of age, and my wife saw you traveling in another venue speaking to other younger health professionals, which is just about everybody in the field at this point. And a lot of people obviously are having you speak about longevity because you believe, from what I've heard you speak about, is you don't just think it was luck that you're 100 years old and doing as well as you are.
No, I don't think so. I think I've lived a proper lifestyle, and the things that cause death I've kind of avoided.
Well, you got to tell us about this. I mean, because when I talk with people, I mean, sure, one of the things that gets a lot of people's attention is avoiding leading causes of death. And there is, you and I were speaking off air before the show, there's been a lot of major medical advances over the years. Kind of walk us through that from your perspective of 100 years and what, over 65 years. Is that fair to say in the medical field?
That's right.
So what kind of advances have you seen?
Well, Pasteur, years ago, through his flash studies, we discovered the germ theory. That was a tremendous advance. Then Fleming discovered penicillin, tremendous advance. Now we have a new one, tremendous advance that hardly anybody's heard about. And that is, with proper lifestyle, avoiding 7 risk factors, we can reduce the risk of the major cause of death in industrialized countries, which is heart attack and strokes. We can reduce them 80%.
Wow. Reducing heart attack and stroke 80% with 7 lifestyle factors. Did I hear that right?
Yes.
We're all ears, John. What are these 7 factors?
All right, let's list what they are. Alcohol, tobacco, inactivity, no exercise, overweight, overeating, and then the next one they gave was too much meat and sugar. And then they added to that high blood pressure and high cholesterol. But there was a rebellion by the population of the United States against this recommendation of too much meat. They didn't like that. So the Heart Association changed it. It said just eat more fruits and vegetables. But that didn't handle their problem with the cholesterol story. So they added another one. They added this one about saturated fat. No more than 5 to 6% of your calories should come from saturated fat. They don't use any bad words like vegetarian diet or meat or things like that. They just say cut down on saturated fat. But now the secret of that is it means vegetarian diet. If you can get somebody to figure it out, you got to get rid of the meat fat and the dairy fat if you want to get down that low.
So is it fair to say that Dr. Scharffenberg, you heard this message early on in your life and put it into practice?
Yes, that's true. I've been a vegetarian lifelong, so that's number one. And for example, diabetes. The non-vegetarian is 3 times more apt to have diabetes on his death certificate than the vegetarian. The vegetarians are living a lot longer. In the studies but done by Loma Linda of Southern California population, the average American man here in Southern California, what percent of them live to be 85 or greater? It's not very many. It's 19.5%. But for the vegetarian Adventists that they studied, 48.6% live to be 85 or older. Now, the women live longer than the men. So for the women in the general population, 39.3% live to be 85 or older, whereas for the Adventist vegetarian women, it was 60.1%.
Wow.
So you live a lot longer because you don't have the chronic diseases.
So a lot of people, you know, the argument, John, a lot of folks will say, well, hey, I don't like those kind of foods. I'd rather live a shorter time and enjoy my life than eat all these things like rabbits eat. What do you tell someone like that?
Well, I eat the foods that I enjoy. I enjoy fruits a lot more than even the vegetables. So when you say vegetarian diet, most people don't think of the fruits. I eat a lot of fruits. I have 2 mangoes right now waiting for me. I like persimmons. I like bananas. You know, I just love the fruit. So I eat a lot of fruits, not just vegetables. I like the grains too.
Okay. So we're not talking about just eating salads all day.
No.
Okay. So it's a varied plant-based diet. And I mean, that's pretty impressive data that you've shared if you're wanting to live not just a long life, but isn't it connected with quality of life as well?
Oh, it is. It is. When you're healthy, you're able to do more. It's kind of exciting. I'm still getting around. I drive in my car. Now, for example, if you take all the people who are 100 years of age, you take 100 of them, what percent of those are men? 15 to 20 only. 15 to 20.
Is that all? Okay.
And what percent of those are driving a car? Very few. I drive my own car. I have no problem driving a car even at night. So you're healthy for longer. You're able to do much more longer.
Well, let's talk about this physical activity piece. And, you know, one of the questions, well, I'll just tell you, as a clinician, you know, as a practicing physician over the years, I've noticed something interesting. Sometimes I'll actually see a person who was a highly trained athlete at some point in their life. Some years ago, I remember a couple that came into my office. They were both elite runners. And I asked them, like, well, how much do you run right now? They say, oh, we both hate running. We ran competitively for all those years. We don't run at all right now. And sometimes it seems, for various reasons, people that might have been very athletic at one point no longer are. One of the questions that often comes up is, well, how much activity? What kind of activity? Do you have some insights as far as just kind of guiding my listening audience?
Yes, I do. I think in Hawaii, they did a good study. They compared those who walked or ran 2 miles or more a day compared to those who walked 1 mile or less a day. And those who did the greater amount of exercise had only half the death rate. That means with 1 hour of exercise a day, compared to those who don't get any, you're cutting your death rate in half. That's tremendous advantage.
That really is. That really is. Now, you mentioned alcohol and tobacco. And I know in Indian country, there's a lot of emotions when they hear both those terms. I mean, tobacco, of course, has been used sacredly by many tribes for many years. We're not talking about commercial, addictive tobacco, people smoking packs a day or anything. So that could bring up a whole conversation there. And then alcohol, my understanding, John, from my reading, from my talking with people in Indian country, is there was no distilling of alcohol. These high concentrations of alcohol like came from European products on this continent when, you know, indigenous peoples lived here. First of all, let's talk about alcohol first. What is the big concern with alcohol when it comes to longevity?
Well, alcohol is a problem. I think women's breast cancer, for example. Now, there was a man who did the biggest study just ever done, Max Griswold from the University of Washington in Seattle. He studied alcohol use in 195 countries. This was funded by a man who had a house just behind the university there, Bill Gates. He funded all this.
Okay.
And this man, Dr. Max Griswold, was a social drinker. He used some alcohol. He wanted to know how much was safe to drink. Now, we have in the past said 1 drink a day for women, maybe, and 2 for men might be okay, safe. Well, he did a big study, the biggest ever done, and he came out with the answer to this question. It was 0. And so we've changed our whole idea of what we recommend now. We used to recommend 1 or 2 drinks. It's okay, but no more than that. But now the recommendation is 0. And so he says he has to review his own lifestyle. Now, this article was published in the Lancet, the British journal, which is kind of interesting. But it was funded by Bill Gates, and it's the most definitive study we've ever had. So if you're going to drink, you have to know it increases the risk of death from some cause.
No, I appreciate you mentioning that. And it does seem, you mentioned the British journal, The Lancet, that published this. It seemed like the Europeans have embraced this message better than some of us in North America. I've seen a lot of papers now talking about just what you've mentioned, that there's really no level of alcohol that is safe, especially, as you mentioned, when it comes to cancer. And I'm glad you mentioned breast cancer, because breast cancer in women, it's, like you said, it could be very small amounts of alcohol that measurably increase a woman's risk of that cancer. And like you alluded to, John, that is one of the leading cancer killers, isn't it?
It is. Now, I was surprised. My wife had an unusual kind of a leukemia, a blood disease, never caused any trouble. There was no medicine for it. They just monitored it for her the last 9.5 years of her life. It didn't decrease her longevity or anything. But I was in the waiting room to see the doctor one time with her and the cancer specialist. And I was reading what he had in the literature for people to read. And he had one on breast cancer. It didn't make one remark about alcohol and breast cancer. So when I got in the doctor's office, I said, "What's going on here? Your literature here doesn't say alcohol has anything to do with it. Breast cancer, and everybody knows that's not true. It does have a lot to do with it." He said, "It's a political thing. It's a political thing. They camp it out because it's political." But
oh my, okay.
Let me give you another idea here about the exercise part. I had a lady helping me with my PowerPoint lectures. She was a graphic artist, excellent. She did it for advertising purposes, did it for a living. She was so good at it, but she was really big. I mean, really big, big. Mm-hmm. And so I said to her, I got to talk to you about your weight. I'm a preventive medicine doctor. I must talk to you. Her face fell, and I said, "Do you want the bad news first or the good news first?" She said, "Give me the bad news first." I said, "You should know that for everybody who's overweight like you are, it increases your risk from dying from almost every disease we can think about." But now the good news, if you exercise, even though you're obese, you will live longer than the woman who's normal in weight who doesn't exercise. Mm-hmm. And then I said with the men, for example, a man who smokes, he has high blood pressure, high blood cholesterol, but he exercises every day, then we know that he's going to live longer than the person who doesn't exercise.
Wow, this is such powerful stuff. We want to speak more about lifestyle and the things that can make a difference. I'm speaking with Dr. John Scharffenberg, a medical doctor, also has a master's degree in public health. He's 100 years of age. You may have seen him in other programs, been featured a lot lately throughout the globe for longevity. He's sharing some of his longevity secrets, but not just things that he's done, things in the medical research literature. I'm Dr. David DeRose. We'll be coming back with more right after this.
Today's broadcast has been pre-recorded. However, if you have questions about today's show or would like further information, please reach out to us on the web at AIANL.org. That stands for American Indian Alaska Native Living. Again, AIANL.org. Or you can call us at 1-800-775-HOPE. That's 1-800-775-4673. We'll be right back after this.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid. But there is hope. Reach out to someone. Connect with your friends. Stay in touch with your community. And know that you are not alone. Learn more at wearebroadcasters.com/hope. Furnished by the National Association of Broadcasters and this station.
When Jim died, I wondered if I would be able to keep the farm. Then I heard about the USDA's loan program for socially disadvantaged farmers and ranchers. It's for women and minorities who may be having trouble getting credit. Once I was approved, the USDA's Farm Service Agency helped me get the credit I needed. Now I don't have to sell, and I can pass the farm down to my kids the way Jim's dad passed it down to him. I know he'd like that.
Contact your local USDA Service Center or visit www.fsa.usda.gov.
Social Security is with you through life's journey from birth to retirement. As your life changes year to year, so do your needs. For over 80 years, Social Security has helped to meet your needs and is committed to improving access to the services that make a difference in your life. Today, you can verify your earnings, estimate your future benefits, apply for retirement, manage your benefits, and even change your address, all from the comfort of your home. Social Security's online services help put you in control with secure access to your information anytime, anywhere, allowing you to spend more time with family, friends, or simply just enjoying the day. Social Security, securing today and tomorrow. See what you can do online at socialsecurity.gov.
Produced at U.S. taxpayer expense.
You're listening to Dr. David DeRose on American Indian and Alaska Native Living. Your comments and questions are welcome. Call now at 1-800-775-HOPE. That's 1-800-775-4673. Here again is Dr. DeRose.
Welcome back to American Indian and Alaska Native Living. I'm Dr. David DeRose. My guest today is the 100-year-old physician and public health educator, still active in the field, Dr. John Scharffenberg. John, a lot of folks have met you over the years. They may have even been taught by you. I have actually sat in some of your lectures in the past over the years. You were actually on faculty, weren't you, for a period of time at Loma Linda University School of Public Health?
I've been on the faculty for 63 years at the School of Public Health.
Really, 63 years?
Actually, I was on the faculty before we had a School of Public Health. So altogether, it's been 63 years.
Wow. So you were one of the early people who got a master's degree in public health, and there weren't a lot of places offering that degree. Tell us a little bit about that story, from a physician to someone going for an MPH, which was unusual back then.
Yes. Well, they didn't have boards in public health at that time when I just got through school. That's when they just began. And I did serve at the San Bernardino County Health Department. I ended up the director of that department, and they counted as residency that I worked there. So I was able to get a board if I wanted it, but I didn't because I was ahead of the boards. I was before the boards even were there. But the reason I got into this public health business was my bringing up in China. I grew up in China, and we had a doctor, the China doctor there, Dr. Miller. He built 15 hospitals in China, and he had special training in Johns Hopkins University on how to take out goiters. He was known that in China, and there was just thousands of goiters. He took a lot of these goiters out. And here I was, 12-year-old boy, watching this popular doctor, and his fame was the goiter operation. And I said to myself, why doesn't he give the people iodine so they don't get goiters? Well, that shifted me into the prevention idea. Now, I argued whether I should be a doctor or a minister, and I saw the doctors had a little bit more influence with the people than the ministers, so I chose to be a doctor. But I joined a school called the College of Medical Evangelists. That was a combination of minister work, and medical work. I did that, and then when I got done, I knew I should go into prevention. I knew there was not much money in it. And so when my son wrote a paper about his father being a doctor, he said, but he's probably the poorest doctor in the world. Because I've worked for the church so many years and, for mission work and things like that. So I've never gotten a lot of money. But I did go into the medical field, and I believed in the ministry with it. And I did go into prevention. And I chose nutrition because a lot of people are thinking religiously when you talk to them about nutrition.
Now, this is a very interesting topic. So you, back many years ago, if I'm remembering right, we had spoken a little bit about this earlier. We're talking like in the 1950s that you ended up at Harvard University in their School of Public Health. Is that right?
Yeah, I graduated in 1956 from Harvard.
Okay, so we're talking a long time ago. Back then, stuff that we just say is common knowledge was not at all common. Now, give us a little perspective, because I came along quite a bit longer in the story, but I can even remember running a preventive medicine department in a hospital, believe it or not, in the 1980s. And there was still a lot of question about how important blood cholesterol levels were. Were they even talking about cholesterol, for example, in the 50s?
Yes, they were just starting. I was doing some research on it there at Harvard. They were just starting on it, on the cholesterol. It was not a common word in the public at that time.
And so what did you start to learn in those early days, and what kind of messages were you giving?
Well, Dr. Harding preceded me at the School of Public Health at Harvard. He got his doctorates there, and he started the School of Public Health at Loma Linda. And Dr. Harding did studies to show that the vegetarians were better off on their diet as far as the heart attacks were concerned and the cholesterol level and all that than the other people. And he was questioned about that a lot. Wouldn't vegetarians be biased in such studies? And he said, well, wouldn't the non-vegetarian be biased on the other side? He had a good answer for them in their questioning.
Well, one of the interesting things that Dr. Harding did early on, I'm glad you mentioned his name, and I've often referred people to this, and I don't know if it went back to the 50s or 60s, maybe you remember when he published this, but one of the arguments that a lot of people have had over the years is, we don't want to leave off the meat and dairy because we're afraid we won't get enough protein. And Harding and Dr. Stair there at Harvard, I know they looked at, I don't know where they found that many vegetarians back in the 50s or 60s, whenever they did the research, but they found that the people, even on a total vegetarian diet, they got plenty of all the necessary amino acids to make all their proteins. Why didn't that data get out there better, John? Any insight into that?
Well, he did publish his material, but it's a shame that a lot of the stuff didn't get out there. But we know that we're getting too much protein now. For example, 1 out of 7 people in the United States has chronic kidney disease.
Mm-hmm.
And all these exercise specialists are trying to tell you to build your muscle up by diet, by eating a lot of protein, when they don't know anything about your kidneys. And the nephrologists agree that if everybody had lower protein intake in their diet, that we could reduce by 32% our kidney disease deaths. They all agree with that. We're getting too much protein. So I've been lecturing to the exercise specialists. You should get better muscles, bigger muscles by exercise, not by diet with protein.
Let's talk about this kidney failure, because I know in Indian country it gets a lot of attention. Some years ago, I was actually speaking in a tribal health clinic, and I was speaking about high blood pressure, and one of the tribal health workers said to me, I'm really glad you're mentioning this, because I just saw a patient and they were diagnosed with end-stage kidney disease. They're having to go on dialysis, and the person was shocked because they didn't have diabetes. And in this person's mind, you had to have diabetes to have kidney failure. So here's the question. We're speaking about risk factors for kidney failure. We know high blood pressure and diabetes are two of the big ones. But if someone doesn't have diabetes or high blood pressure, or if they do, I mean, are you saying that protein intake is a risk factor independent of other things that people might have going on?
Yes, it is. It is. It's a big risk factor.
So one of the messages for a person who's concerned about kidney function is to try to decrease that protein consumption. Is that fair to say?
Yes. You see, the doctor doesn't tell people they have a problem because he doesn't think they have a problem until their BUN goes up in their blood level. And so that's a late stage. Then it's too late to cut down on the protein in the diet and help yourself. But if we brought people up on a low protein diet, we're not likely to get kidney failure.
Wow, that's an important message. So we're talking about longevity. We've touched on, of course, cancer, especially with the connection with alcohol. We've spoken about cardiovascular diseases and diet and cholesterol and physical activity. We haven't spoken much about the addictive tobacco. And I know, as I mentioned earlier in the show, sometimes that raises some concerns in Indian countries. So we're not going to talk about occasional ceremonial use. That may be worth talking about in some setting. But let's just focus on the commercial tobacco, people that are using this on a daily basis. What would be your concerns as a public health professional? What would you tell someone who's smoking or using chewing tobacco?
Well, that's the most important thing to get rid of, to live longer and more healthful, is to get rid of tobacco. And, you know, we've done a fairly good job in this country, the United States, because only about 14% of the adult population is still smoking. But in California, where you have few more of the more highly educated people living, more intelligent people, it's only 9%.
Wow.
Of the adults that are smoking. So we've done a pretty good job of lowering our heart attack rate because of dropping in smoking. But now it doesn't tend to drop any lower than because of three problems. One is hypertension. That is now the major cause of heart disease in the U.S., hypertension. The other is diabetes. And the other is overweight. About 20% of our kids are obese, overweight, and about 40% of adults overweight. Now, these kids, Harvard did a study on these kids. You let 35 years go by, and 50% of them will be obese. So obesity is still a big problem in this country. We got to do something about it. And smoking it overseas is a big problem. So I keep lecturing overseas. I'm lecturing a lot overseas. And I tell them they should do something about tobacco real quick and make a law that people should not be allowed to buy cigarettes till they're at least 20.
Okay. Well, we're glad that you're not only a public health professional, but you're giving political counsel worldwide. We want to talk more, John, about practical lessons. We have to step away just briefly. I'm speaking with Dr. John Scharffenberg, a 100-year-old physician and public health educator who's educating people throughout the world. You're going to hear more from him. If you stay by, I'm Dr. DeRose. We'll be back right after this.
American Indian and Alaska Native Living will continue in a moment. If you have questions or comments about today's pre-recorded broadcast, please contact us on the web at aianl.org or call 1-800-775-HOPE. That's 1-800-775-4673.
A message from the National Police Association. It used to be that any able-bodied person would offer to assist a police officer in danger. Now, passers-by are more likely to take a video. There's a better use for your phone when an officer's in trouble. Call 911. Tell the operator where you are and what you see. Then, start your video to provide evidence later. To learn more about how you can assist law enforcement, visit nationalpolice.org. That's nationalpolice.org.
Unlike other health concerns, mental illness is not always easy to see. Depression won't show up on an eye chart, and you can't measure it on your bathroom scale. Sorting out a mental health concern is not something to attempt on your own. You won't find a bipolar disorder by looking at a thermometer. Like many other health conditions, help for mental illness takes professional diagnosis and treatment. Anxiety won't just go away under a stick-on bandage. So the sooner you seek treatment, the better. If you or a loved one has a mental health concern, don't go it alone. Find out what to do. For 24-hour free and confidential information and treatment referral, call 1-800-662-HELP. Learn more at samhsa.gov/support. That's samhsa.gov/support.
Using meth taught me everything about freedom, only not like you think. It taught me how easy it is to lose your freedom. If you think meth is taking control of you, ask for help. You have the power to be truly free. I know. I'm Jan, and I'm free from meth.
If you or someone you know is struggling with meth, call 1-800-662-HELP for 24-hour free and confidential treatment referral. Learn more at samhsa.gov/meth.
You're listening to Dr. David DeRose on American Indian and Alaska Native Living. Your comments and questions are welcome. Call now at 1-800-775-HOPE. That's 1-800-775-4673. Here again is Dr. DeRose.
Welcome back to our second half of today's show, American Indian and Alaska Native Living. Dr. David DeRose with Dr. John Scharffenberg. We're speaking especially about longevity. It's an appropriate topic because I'm speaking with a gentleman who is 100 years of age and still very active in the medical field, health education field, traveling worldwide, internationally, making a difference as far as people's health. Dr. Scharffenberg, we were speaking about some of these different lifestyle strategies and some of the risk factors for premature mortality. One of the things we've mentioned several times is high blood pressure. Can you give us just a little bit of perspective on that?
Well, we've knocked down smoking so well in this country. Adults, very few of them are smoking now. So that has helped. But we still have too many people with heart attacks still. And the reason we still have it is too many people with high blood pressure. So we need to do something about it. Now, we know overweight increases it, tobacco increases it, alcohol increases it. Those are things all bad for it. We know exercise is the best preventive of hypertension that there is, exercise. So we should get into that. And diet-wise, we got to get the weight down to help reduce blood pressure. But if you take animals, you give them enough linoleic acid, that's plant oils, no amount of salt will hurt them at all. They don't get hypertension. If you give them enough potassium, salt doesn't hurt them. But where do you get your potassium? That's fruits and vegetables. That's where you get the potassium. We found out, for example, if you're on 12 grams of fiber a day, instead of 24 grams, you have 57% higher risk of high blood pressure. We need to get adequate fiber in our diet. Well, meat, for example, has no fiber. It's a deficient food. People don't realize how deficient it is. It has no carbohydrate, has no fiber for these steaks.
Now, John, this is perplexing, I think, to a lot of people. I mean, what's the connection between fiber intake and blood pressure? Does anyone know why there's that connection? Why would more fiber help you have better blood pressure?
We aren't sure exactly why it is yet, but we know it's true. Much higher. If you cut your fiber down to 12 grams from 24, you increase your risk of hypertension 57%. So we know that.
Wow. So we're talking about diet, exercise, avoiding some of these things that raise blood pressure as well. I know I hear a lot of people, they'll even come into my office. This is not uncommon. Someone's pressure will be really high and they'll say, oh, I'm really stressed and that's why my pressure's so high. Is stress really a driver of high blood pressure?
Well, I think stress is, but our problem is we don't know how to measure stress. We don't know whether it's one stress or 10 stresses that you're undergoing, So
fair enough.
Our problem is we don't know how to measure it. So that doesn't get into a lot of our statistics. I think it's a problem, but it doesn't get into our statistics.
And of course, a lot of people would say that exercise, one of the ways it may give additional benefits with blood pressure is by helping manage stress and lower those stress hormone levels.
Yeah, that's right.
So let's tie this in with another topic that I know when we speak about longevity, this almost always comes up because people say, well, I don't want to live to be, 80 or 85 or 90 because when mom got to be 78, she had dementia and I'd rather just die before that. But here you are interacting with us, quoting all this medical research and this data, and you're on top of your game still at 100. What can we do, even if we're living longer, to keep our brain clear? Is high blood pressure one of those things that's a danger for dementia?
It is. It is a big problem. And we should know that exercise is important in a certain time of life. People aren't emphasizing that. But it's important in mid-age, from 40 to 70. In other words, do I exercise now? Yes, I should exercise more. But the exercise that's important in decreasing Alzheimer's disease probably is the exercise that's done in mid-age, 40 to 70.
Interesting.
But that's the time when people get more money, they relax more, feel they don't have to exercise so much, and eat more food. So they get overweight and they don't exercise. We need to turn it around. As you get older, you need more exercise and get thinner. Don't get heavier.
Well, it seems like you've been able to keep your weight. You've been at a good weight. I mean, I've known you for many years, and it doesn't seem like your weight's changed much. Do you have any special recommendations from your own experience?
Well, yes, I do. I started on something years ago because I read it in some books written by Ellen White that says, look, if you eat but 2 meals a day, skip your supper, you'll be better off. So I brought up my kids on that program, and I'm on that program. And it's interesting that at Weimar, who started the New Start program with exercise in it, they have now put 2 meal a day program into their recommendation. 2 meals a day. Well, and Neil Nedley, director of Weimar University, he wanted me to speak this last time a little bit on what happens about ketosis, ketones. And on 2 meals a day, you actually get into the ketosis mode where all the brain cells, all the cells of the body, instead of living on glucose for a period of time, live on the ketones. Now, there's a number of the ketones, but there's two ways of doing this ketosis business. One is cut your carbohydrate down to 50 grams and add a lot of fat to it. So that's not a good way.
Doesn't sound like it.
Carbohydrates are fruits and vegetables. We need that. But the other way to do it is go fasting 1 or 2 days a week or doing 2 meals a day, skipping supper. But a recent study just came out, and they said with the intermittent fasting, it increased heart disease risk 91%. Well, I think most people with the intermittent fasting term, they're skipping breakfast. They are not skipping the evening meal.
Interesting.
So there's a lot of people I know that are skipping breakfast, but we need to skip the evening meal, not the breakfast meal.
Okay. So there's value to the fasting. It pushes us into a state that you mentioned called ketosis, where our body is burning fat for energy. And there do seem to be specific benefits to that for the brain as well as the rest of the body?
Well, they think with Alzheimer's disease it may help them. They have for years been using it for kids who have too many epileptic seizures. They put them on that for a period of time, try to cut down on these seizures. Then they go back to a normal diet again. But It's true that ketosis, we can get it from the fasting idea, and it's surprising. But 16 to 18 hours, ending one meal, lunch meal, till breakfast the next day, does put you into that mood, and they do think it might help Alzheimer's disease.
Very interesting. So, Dr. Scharffenberg, I mean, there's a lot of diseases that get people's attention. We've spoken about a lot of the leading killers, but one of the other disease processes that I think has been getting a lot of attention, and I speak of a general process, are these autoimmune diseases. And whether we speak about rheumatoid arthritis or lupus, or whether we speak about inflammatory bowel diseases like Crohn's and ulcerative colitis, there's a lot of people that seem like they're being diagnosed with autoimmune diseases. From your research, does it seem like lifestyle has any bearing on these conditions?
Well, we know from the Loma Linda studies of Seventh-day Adventist vegetarians that they have less rheumatism, maybe 50%. They have less kidney disease, 50%, and less hypertension, less heart attack. So the vegetarian diet really is a big deal in a lot of things. And we don't know exactly how it all works yet, but you have less chronic disease. Many of the diseases you don't have so much of if you are on a vegetarian diet.
So I know for many people, we've touched on this a little bit, but I want to go a little bit deeper. So people hear vegetarian diet and they're, some of them maybe already turned off the radio show. They can't wrap their minds around that. What do you do as a health educator when you're speaking with someone who's eating lots of meat or milk or eggs or cheese? Do you say go on a total vegetarian diet, or do you try to gradually move them in that direction? What strategies have you found that work when you travel, throughout the world?
Well, I tell them to make changes gradually. They get too much fiber too fast, they'll get diarrhea, they'll get into trouble. So I say make changes gradually. Make one day all vegetarian, and then after 3 or 4 months, make it 2 days a week and gradually increase it that way.
Good. I like that strategy. So people gradually adding things, kind of those meatless days or those vegetarian days throughout the week.
Yes.
Now, I've heard something attributed to you. I don't know that you and I have ever spoken about this, but I was speaking with someone, I think they were overseas, and they said, well, John Scharffenberg came here and we told him that you can't eat vegetarian foods here because they're too expensive. And the rumor that I heard is you actually went into local grocery stores and you showed people how they could eat inexpensively. Is this true, or is this just someone made this up?
Well, we took the U.S. Department of Agriculture's study on this years ago. They showed how much nutrients you got, listing all of them with each food group. And I had a system of putting them all together to get one number. And 4 groups give us the most nutrition for the dollar. And that's the potatoes and the grain group. They're equal. They were the best. That's whole grains, not refined grains. And then the next thing was the beans and peanuts. Well, peanuts are bean. So the beans and peanuts, the next group that did the best. And then the green leafy vegetables next. And the worst nutrition for the dollar was from sugar. Everybody should know that. But just above sugar was the meat and fish group. Not that there wasn't some good nutrition in the meat and fish, but it's terribly expensive for the amount of nutrition you get. People don't realize how expensive it is. So if you're poor, you should go to a vegetarian diet because you get more nutrition for the dollar. We've done that study in Romania. A Romanian doctor did it. We've done it in Latvia. We've done it in Mauritius. We've done it all around the world. And it's true that these food groups that we mentioned, 4 food groups, are the best in giving us more nutrients for the dollar.
Well, what I love is that you did this internationally. So it's not just U.S. Dollars, but if you travel throughout the world, you can get the best nutrition for the least amount of money if you emphasize those plant foods. I love that message, John. We have to step away just briefly. You're listening to Dr. David DeRose. I'm interviewing Dr. John Scharffenberg. He's a medical doctor, an MD. He is also someone who holds a degree, a master's in public health degree from Harvard University. He has been educating people all over the world, and in the last segment, he's got more wisdom that he wants to share with you. Stay with us. We will be back right after these messages.
Today's broadcast has been pre-recorded. However, if you have questions about today's show or would like further information, please call 1-800-775-HOPE. That's 1-800-775-4673. We'll be right back after this.
If a natural disaster comes knocking, how prepared is your family? You can't just close the door on earthquakes, floods, or hurricanes and hope they go away. That's why it's important to make a plan now. Ready.gov/plan has the tools and tips you need to prepare your family for an emergency. So if disaster shows up at your doorstep, you'll be ready. Visit ready.gov/plan and make a plan today. Brought to you by FEMA and the Ad Council.
I'm just texting him back. I'm just posting a story. I'm just changing the song.
No. When it comes to distracted driving, just don't. Sending a text takes your eyes off the road for just 5 seconds, but in that time, your car can travel the length of an entire football field. Any distracted driving just isn't worth it.
Visit StopTextsStopWrecks.org. A message brought to you by the National Highway Traffic Safety Administration, Project Yellow Light, and the Ad Council.
What is a number story?
My number story started with fear and a lack of support, and it has led me to be there for others.
A number story begins in our childhood with ACEs, adverse childhood experiences.
My number story begins with the separation from my father and the emotional abandonment from my mother, and leads to me being a role model to not only myself, but those around me by becoming the person that wasn't there for me.
ACEs are so common, 2/3 of us have one.
My number story begins with drug abuse and homelessness, and leads to realizing that I can live life by my own standards.
A study found the more ACEs, the more likely we may experience a host of serious health effects, physical and mental, but that doesn't need to be the case. Your ACE number is simply an entry point to your own story. Where it leads is up to you.
My number story begins with years of emotional abuse and leads to peace, clarity, and security in my self-worth.
Take control of where your number story leads at numberstory.org.
You're listening to Dr. David DeRose on American Indian and Alaska Native Living. Your comments and questions are welcome. Call now at 1-800-775-HOPE. That's 1-800-775-4673. Here again is Dr. DeRose.
Welcome back to our final segment of today's edition of American Indian and Alaska Native Living. Dr. David DeRose with Dr. John Scharffenberg. Dr. Scharffenberg, we've been speaking about the benefits of lifestyle and how it can help us live longer and better. You're a living example of it at 100 years of age, medical doctor and public health professional. But Dr. Scharffenberg, I've just got to bring up another one of these topics that come up when I speak with people. We start talking about eating more plant foods, avoiding the animal products, including the dairy, and immediately people start asking about calcium. Can a person get adequate calcium if they leave dairy out of their diet?
Well, the EPIC Oxford study showed that the total vegetarians who don't use any milk or eggs have 37% more fractures than those who have milk in their diet. But if they get 525 milligrams of calcium a day, there's no increase in fracture risk. So in Poland, there's several groups of people that have studied how much calcium would one get if he didn't use any dairy products. Of the group over there, they figure they're getting about 250 milligrams if they use no dairy products from foods normally. Now, how do you bring it up to 525? A cup of cow's milk will do it. That's 300 milligrams. And most of the artificial milk substitutes too have also fortified that with the same amount. So if you take an almond milk or soy milk or something, it'll have 300 milligrams of calcium per cup. So that would add to the 250 550, more than the 525, which is necessary. So that's one thing that you should know, how to get adequate calcium. Another thing you should know, more salt you eat, the more calcium you excrete. And that's a problem. We're excreting too much. Dr. Hegstead, my professor in Harvard University, he pointed out that we're getting enough calcium, but we're excreting it too fast. We're getting rid of it too fast. And if you cut your salt intake in half, you would excrete less, so it'd be like taking a pill with 900 milligrams of calcium per day.
Wow. So cutting down the salt in the diet can actually help with your calcium balance.
That's right. So osteoporosis, lack of calcium maybe. Oh, because too much salt. We need to get down on the salt. The second thing you need to know, naturally, that you can do, if you got to make sure your vitamin D in your blood is okay. That has to do with the absorption from the intestinal tract. If you have adequate vitamin D in the intestinal tract, you're going to absorb 2 to 3 times more calcium. So that's another good thing to do. And then there's other foods that have a lot of oxalic acid or phytic acid, which combine with the calcium to make a calcium oxalate, which you can't absorb. It doesn't mean you don't eat the spinach. You don't eat that food. It doesn't mean that. It means you don't count the calcium that's in it as doing any good for your calcium.
So that list, you mentioned spinach. I've heard Swiss chard as well. Are those the two main ones?
Well, your cabbage. You skip your regular American type of cabbage and you go to bok choy, Chinese cabbage. Okay. Broccoli is very good. Now, even though soy has some oxalate in it, it's still well absorbed. We don't understand that. And there's a couple of foods that I really recommend a lot. And one is soy and the other is avocado. The soy I recommend, but we aren't getting enough of it in this country to do the good. For example, in the Loma Linda studies, the people who drank more than 1 cup of soy milk a day had only 30% the risk of prostate cancer.
Wow.
See? So that's pretty good, but they have to drink enough. And same with I got all kinds of studies to show you need enough soy to do you the good. It's very good for us. But you take that one box of 400 grams, I recommend a quarter of that each time you eat it. 4 days, finish it up. 100 grams of that a day is more like what we should be getting to do us the good.
So I've heard a lot of people getting worried about soy products. Are there any legitimate worries with soy?
There was when it started. There was some things that started. We're worried about the breast cancer, increasing the risk and so on. But they went over to Asia and they took all the Japanese and the Chinese who had breast cancer and they had the breast removed and they watched to see which ones got it on the other breast. And the ones that had the most tofu had the least recurrence. So since that time, they haven't worried about this as far as breast cancer is concerned.
And then in men, some people say, well, if soy has these phytoestrogens, is this somehow going to be damaging to a man? But I've already heard you making a case that it actually is protective for prostate cancer. Is that the main thing to keep in mind?
Well, yes, but the amount that people get from the food is so small compared to the amount the doctor gives to the patient that is really not comparable at all.
So men shouldn't be worried that they're going to become feminized by eating more soy?
No.
Okay.
They get feminized if they're eating the neck of the chicken that has a steroid put in the chicken to make it fatter. If they get that steroid pill in their mouth, that's going to cause a problem.
Fair enough. Let's talk about this other topic that we've touched on a number of times. I think some folks are often asking, practically, what can they do? We've spoken about exercise, and you mentioned especially this vital time in life between 40 and 70. Some people say, but I have a hard time exercising, I have joint problems. What kind of recommendations do you give people about physical activity?
Now, I don't know if you've heard of Stephen Blair.
You sure I have?
He just passed away last October.
I did not realize that.
84 years of age. He was short and plump. Okay. But I asked him the question, how can I educate my people to exercise so they don't get joint problems? And he said, we've done many studies on this. He sent me 50 pages by email of his copies. He read me 800 papers at least. And he pointed out that exercise doesn't cause the problem. These people who have joint pains have been playing football. They have an injury. Then exercise aggravates it. So they've had something else. He said exercise does not cause the joint problems. It's the injury you've had before that's doing it. And I thought that was very interesting.
And I'll tell you what I've used with my patients. I mean, the rule of thumb I've used, and you could tell me if this resonates with you, I'll say, even if you have joint issues, I'll say, go into something gradually. And if the joints are not worse the following day, that's usually a good indication that you haven't overdone it. Do you think that holds water, or do you think there's a better way to educate people?
I think that's good, but I think there's evidence that too much exercise can cause your increased death rate just as much as too little. I hate to tell anybody that because hardly anybody's doing too much. But, for example, we're trying to figure out how much is too much. They're talking about 10 miles a day of walking. If you did that every day, it's too much. It's just like no exercise at all. If you run more than 5 miles a day, every day, it's too much. You're going to die just as soon as the people who don't exercise at all.
Interesting. Okay, well, that definitely keeps things in perspective for us. So you can overdo even a good thing. You can eat too much of the good foods too, I'm assuming?
That's right. You can drink too much water, makes your blood sodium go down, your brain swells, and you can die from that.
Well, since you brought that up, how much is too much water for the average person if they're not on medication?
Well, it's hard to tell unless you do the blood tests to see what's happening to the blood sodium. But I say if your urine is clear at least once during the day, I think that you're getting enough water.
Yeah, and some of the data I've seen, John, over the years, it's for the average person, you're right, I mean, it can vary, but it's like 3 to 4 gallons a day that it would take to get that sodium dangerously low. So it's not like we're talking about if you take an extra glass of water by accident, right?
No, mine went down sodium with 9 glasses a day.
Okay.
So I think everybody differs a lot.
No, I appreciate what you're sharing. So we definitely want to be careful. Well, our time is just about done. Any final remarks, John? Any final words of wisdom you want to leave our listeners with?
Yes, I want to give you the one-sentence university course in nutrition. Everybody should know. That's the only original thing I have. And here's what it is. Eat at the right time. That means no snacks. Eat at the right time. A variety. Not one meal, because that makes you too fat. A variety over a 10-day period. Eat at the right time. A variety of natural, unprocessed foods in quantities for ideal weight. That's all you got to know in one sentence.
Beautiful. John, thank you so much for sharing your enthusiasm and your 100 years of wisdom.
Thank you for having me.
Thank you, too. And let me thank each of you, my listeners, for joining us in this important show. Hopefully the wisdom of Dr. Scharffenberg will translate into your own lifestyle. As always, I'm Dr. David DeRose, wishing you the very best of health.
Native Voice One, the Native American Radio Network.